Hello, I'm Avalon Newberry, a junior at South Hall High School in Sports Medicine 3, and this is my medical research project on diabetes, new medical technology, and treatments. In this project, I'll be discussing diabetes, primarily type 1 and type 2, old medical technology, new medical technology, and what makes new technology so superior. This video will discuss what diabetes is.
What is diabetes? Diabetes is a serious condition where your blood sugar levels, also known as blood glucose levels, are too high. It's diagnosed from a blood test. There are two main types, type 1 and type 2, which is the most common, and lots of other types like gestational diabetes, type 3C, and MODY. The causes and symptoms depend on the type of diabetes you have. Diabetes happens because of a problem with a hormone called insulin. When you eat or drink, any carbohydrates you've had are turned into glucose, a type of sugar. Insulin acts like a key to unlock the cells to let the sugar in, to give you energy. If you have diabetes, this can't happen, so sugar builds up in the blood. High blood sugars over time can cause problems in almost every part of your body, from your brain to your feet. So treatment is about trying to keep blood sugars within a target range.
I'll be discussing more about diabetes in the next slide.
What is
There are many symptoms, complications, and treatments for diabetes, but it depends on what type you have, which I will talk about right now. Type 1 diabetes is an autoimmune disorder where the body's immune system mistakenly attacks and destroys the insulin producing beta cells in the pancreas. As a result, the body can no longer produce insulin, which is a hormone that helps glucose, sugar, from the blood entering cells for energy. The causes of this are unknown, but it's usually a combination of genetic and environmental factors. Some symptoms include increased thirst, frequent urination, extreme hunger, weight loss, fatigue, blurred vision, slow healing wounds, and numbness or tingling in the hands or feet. If it's not managed properly, type 1 diabetes can lead to heart disease, stroke, kidney damage, nerve damage, eye problems, and possible amputations. While there is no cure for type 1 diabetes, it can be managed with insulin injections or an insulin pump, blood glucose monitoring, diet and exercise, and medications to control blood sugar levels. It is also important to work with a doctor. Type 2 diabetes is a chronic condition where the body does not use insulin effectively or does not produce enough insulin, leading to high blood sugar levels, hyperglycemia. Causes are usually from insulin resistance, where the cells do not respond properly to insulin, preventing glucose from entering them, insulin deficiency, where the pancreas does not produce enough insulin, genetics, and lifestyle factors. Some symptoms include increased thirst and urination, fatigue, blurred vision, frequent infections, slow healing wounds, numbness, or tingling in the hands or feet. Diagnosis for this comes from blood sugar tests and fasting blood sugar glucose tests and A1C tests. Treatments will be lifestyle changes, medications, and monitoring symptoms, and it's also important to work with a doctor. I will be discussing the old technology now. Urine tests are primarily involved tasting the patient's urine to detect a sweet taste, as high blood sugar levels would cause excess glucose to be extracted in the urine, making it noticeably sweet. This method was used in ancient times and the Middle Ages, with doctors even consulting urine flavor charts to diagnose based on appearance, smell, and the taste of urines. Tasting the urine was considered the earliest method, and doctors would literally taste the patient's urine to identify a sweet flavor, indicating if there was diabetes or not. Later on in 1841 and in 1850, Carl Traumer's test and Hermann von Fehling's test was basically a chemical reaction to detect glucose, which later Stanley Benedict solidified this and made it a lot better, and even made it so that you could test for urine samples at home, and made it a lot better. Insulin was first discovered in 1921 by Frederick Banting and Charles Best at the University of Toronto, and it was extracted from the pancreas of cattle and pigs and used to treat diabetes for many years. But this caused many allergic reactions, and then caused for, in 1978, the first synthetic human insulin to be made, which was made using an E. coli bacteria. Also, before disposable syringes, there were glass syringes, and they would be boiled between uses, and not very sterile and not very useful. Some very, very early glucose monitoring systems were the iTone, the Dextrux, the Dextrometer, and the glucometer. All of these really paved the way for glucose monitoring today and helped a lot with the technology, but many of them needed calibration daily and took 30 minutes to warm up. But basically the function of these was to just monitor glucose and tell you when your glucose was down and your sugar levels were down. New technology I will be talking about will be glucose monitors, insulin pumps, GLP-1, and the 3D printing of the pancreas. New glucose monitors are the Dexcom Stelo Glucose Biosensor System, the Freestyle Libre 3, and Abbott's Lingo. These are basically all CGMs and work with your smartphone and an insulin pump or pen to monitor glucose automatically, not manually. And they've all basically changed the game. These new insulin pumps, like the Sequel Twist Aid system, the Omnipod Go, and the InPed, all work with those glucose monitoring systems and automatically inject insulin without having to do pen injections. While there are still some pen injections, even now the pen is automated and was made smart so that they can hold more insulin and also calculate doses based on meal size, insulin to carb ratios, and many different things. They've helped a lot. GLP-1 is mainly for type 2 diabetes as it is a glucagon-like peptide, and basically the function of it is to send messages to your brain and also help the pancreas with insulin and glucogen. GLP-1 is a naturally occurring hormone, and it plays a really big role in sugar levels, appetite, and metabolism. It will stimulate the release of insulin from the pancreas, lowering blood sugar, and slows down gastric emptying, reducing hunger, and promoting satiety, increases metabolism, and burns more calories. Um, this can be seen in forms like Ozempic and many other off-brand, but basically it's an injection that you inject into yourself, and it makes you not have these symptoms and helps with blood sugar control and obesity. Here is my favorite one. It is bioprinting of the pancreas.
Of the Enlight project is very ambitious and has never been attempted before. The purpose is to develop a functional model of the pancreas of a centimeter scale that is derived from human pancreatic cells to test medications for diabetes.
Readily 3D's tomographic printers can print centimeter scale structures in just 30 seconds using light. And it is this combination of size, speed, and resolution that makes this technology particularly suitable for this project. Plus, we print inside sealed containers, which maintains a
of the Enlight project.
Some extra new technology is the iLet Bionic Pancreas, Tidal Loop, and the MIT implantable device, and also other ketone monitors. These are all combination CGM insulin pumps where basically it combines CGM and insulin pumps into one device and makes it so that the device automatically delivers insulin to maintain blood glucose levels. It's usually paired with a Dexcom or a CGM or another CGM, and also connects to the phone. New diabetes technology compared to older system is significantly more automated. Some key differences are continuous monitoring, new systems like CGM sensors to constantly monitor blood sugar levels, whereas older methods primarily relied on intermediate finger prick tests, automated insulin delivery, where newer insulin pumps can be integrated with CGM data to automatically adjust insulin-based delivery based on glucose levels, whereas older pumps required manual dose calculations. Closed loop systems are emerging and also known as the artificial pancreas. This technology uses advanced algorithms to automatically adjust insulin delivery based on real-time glucose readings and to eliminate manual input. This new technology is highly effective and has significantly improved HbA1c levels, and these studies have demonstrated that utilizing CGM and insulin pumps can lead to significant reduction in these levels and helps a lot with blood sugar control. It has reduced hypoglycemia and enhanced awareness around diabetes. It also has significantly improved improved the quality of life for many. While cost and insurance is a big fallback, and patient education and training is hard, and also individual variability, like some of these won't work for some people. New diabetes technology and treatments are necessary and very effective. These new technologies are helping millions of people. While cost and insurance are issues, I hope that we can build a healthcare system that caters to all. Thank you.